All right, so let's talk about the patho behind GERD. Because a lot of times we know what something is, right? We know what reflux is, but what does reflux actually does to the body? What is happening in the body that makes a patient has reflux, right? All right, so the patho behind it is the lower esophageal sphincter, which is the LES, I'll refer to it later on, is to prevent food from moving back up the esophagus. But if the LES does not remain closed due to number one, not having enough pressure, or number two, the stomach having more pressure than the LES, which makes it open. All right, so let me find my little what's this thing called, little laser, right? So we can talk. So we see the stomach. So this is our stomach, right? This is the stomach. All right, so you see right here, this is the sphincter right here. So this is the LES, right? This is the LES, and even on this side, right? The LES. All right, so you see in the closed sphincter right here, this sphincter is closed, and this is our stomach contents right here. You see how where it's closed right here, guess what? Nothing can come up the esophagus, and this is the esophagus right here. But when it's open, as you can see, it's open. So I call the LSE like a door between our esophagus and our stomach. So if this door is open, the stomach contents that is in our stomach are the gastric acids and pepsid, which is a stomach acid that serves to digest the proteins. If that sphincter is open, guess what? It flows up the esophagus, right? It goes up the esophagus, which can cause inflammation and irritation, right? So does that make sense? So the biggest thing with GERD is this sphincter, for somewhat reason, is it's too much pressure in the stomach. Either your sphincter is relaxed, that it doesn't have that much pressure, that it is allowing the door between your stomach and your esophagus to open. Does that make sense? All right. So GERD can be diagnosed two ways, and not limited to these two ways, but these are two ways that I'm focusing on, is by having endoscopy, which allows the visualization of the esophageal muscle. So basically a scope just going down to actually look at the muscles in the esophagus, and pH testing to find out if the contents are acidic or not. And we know that stomach contents are acidic, so pH testing could be done. So we're going to talk about populations at risk and risk factors for GERD. So the most important thing when it comes to risk factors is knowing why something is a risk factor and how does it relate to that disease process. Right, so we learned the anatomy and the physiology of GERD. So now let's apply it. So when dealing with this hernia, it is a part of the stomach that pushes into the chest. So this makes the LES, which is the lower esophageal sphincter, relax and not close like it should. So remember, we call the LES the gate between the stomach and the esophagus. That gate needs to be closed in order to prevent stomach contents from coming up the esophagus, right? So you need to have a certain amount of pressure to keep the gate closed, right? All right, so pregnancy. It reduces the pressure of the LES. Obesity. In obesity, you have increased intra-abdominal pressure, which lowers your LES pressure. With medications, each medications can do different things, but 9 times out of 10, they may lower the LES. All right, with drinking, alcohol damages the lining of the esophagus and it relaxes the LES. We do not want to relax LES. If the LES is relaxed, it is not closing as it should. So it can allow continents to move from the stomach to the esophagus. Smoking weakens the LES. Stress. With stress, you have an increase of acid production. With soda and caffeine, these are highly acidic beverages. So guess what? They put stress on the LES, right? So how about our foods that we eat? The foods that we love, right? So our high fat foods and our fried foods, guess what? They trigger a release of a hormone called CCK, which can cause the LES to relax. So when it comes to patient teaching, your patient may want to know, hey, why can I eat this? Why can I drink this? And you're able to explain it to them. Or when you get on a test and you have to pick out risk factors, you're able to think about the pathophysiology behind why a patient can't have this. You're able to rationalize, okay, a patient is at risk for this because of this. So it gives you the why and the how. I know that was a lot, you guys, but we made it through. Let's continue. So how does the patient look? So this means what are the signs and symptoms that your patient may be complaining of? So they could be complaining of bloating, burping, a sensation of food being stuck in their throat, hiccups, nausea, weight loss, dry cough, heartburn, regurgitation, a chronic sore throat, and hoarseness. So two that I want to talk about is the chronic sore throat and hoarseness. So why would you think a patient would be dealing with respiratory issues with Gerd? I'll give you time to think about it. All right. So a patient could be aspirating on stomach contents. So the contents that are in your stomach could be leaking into your lungs. Acid in your lungs over time can cause permanent lung damage. So sore throat and hoarseness can be caused because of the inflammation to the vocal cords from the acid. So this is just going a little step deeper because you understand what is actually happening, Gerd. You're then able to understand why certain symptoms a patient is having, right? So complications of Gerd. So esophagitis, which is inflammation of the esophagus. Esophageal strictures, Gerd, can cause narrowing and scarring over time. Aspiration pneumonia is when gastric contents go into the lung. Nursing interventions. So these are nursing interventions that you would expect to do for patients with Gerd. So number one, always assess the amount and the characteristics of emesis, no matter which disease processes you're dealing with. If a patient is putting out anything, whether it be stool, whether it be anything, you want to always urine, you want to look at how much, the characteristics of it. You always just want to assess what's coming out your patient. You want to place suction equipment at the bed if the patient is having problems with respiratory issues like we talked about earlier, or if they are aspirating. You always want to have this stuff readily available at the bedside. You want to maintain the head of the bed elevated, especially while sleeping, to prevent reflux. Studies have shown that it can lessen the chances of reflux happening if the head of the bed is elevated. And if we just think about the anatomy of that, then that makes perfect sense, right? Diet modification teachings. These are the type of things that you need to know because I can guarantee you that they're going to be test questions. Anytime it's about diet modification teachings, you need to know them. So you want to limit fatty foods, chocolate, tomato products, carbonated liquids, fruit juices, citric products, and spicy foods. You want to monitor your intake and output. So you want to know it if your patient is taking in this amount of fluid, but guess what? They're vomiting this amount of fluid. You want to make sure that you're keeping a balance of your patient's intake and output. Also, you want to monitor for signs of dehydration. So You want to look at skin turgor. You want to look at their skin. You want to just look. You want to look if their mouth is dry. You want to assess them for signs of dehydration, right? So we want to make sure that we're in a equal fluid balance. So we know that a lack of water and other electrolytes can cause reflux because the stomach does not have enough water to make your digestive enzymes. So you want to make sure that your patient is hydrated. If your patient is dealing with so much nausea that they cannot maintain their hydration by mouth, then IV fluids as prescribed. And your doctor may put some electrolytes in it, but you would give that as prescribed, right? All right, so finally, you're going to administer medications as prescribed. If they're on any antacids, if they're on proton pump inhibitors, and histamine H2 receptors. And we will talk about those medications in just a few. So let's pause and let's see what all we learned. So Nclex question number 1. So after dinner time, during your hourly rounding, a patient awakes to report that they feel like food is coming up in the back of their throat and that there is a bitter taste in their mouth. What nurse intervention will you perform next? A, would you perform deep suctioning? B, would you assist the patient into a semi-phallus position? C, would you keep the patient NPO? Or D, will you instruct the patient to avoid milk products? So we just said the patient, you're doing your hourly rounding, the patient say they feel like the food is coming back up. What are you going to suggest the patient to do? All right. So we're going to assist the patient to a semi-phallus position that could help with that patient experiencing reflux, because we know that being in that upward position, right, can help prevent reflux. All right. So Nclex question number 2. During a home visit, you are helping a patient develop a list of foods they should avoid due to GERD. Which items in the patient's pantry should be avoided? Select all that apply. All right. So let's read through the options. Hot and spicy pork rinds, peppermint patties, green beans, tomato soup, chocolate fondue, almonds, and oranges. So the answer is going to be A, B, D, E, and G. So one that surprised me was peppermint patties, because I didn't know that peppermint causes the LES to relax.